The highest attainable standard of health is a fundamental right of every human being. But current healthcare funding models are simply not sustainable. These two quotes demonstrate the ever-present dialectics in the healthcare industry. On one hand, we want equitable patient treatment. On the other hand, we're in this institutionally resource-constrained environment. So what needs to happen is we need to balance these tensions, and it's really difficult to do so. It's a tight balancing act. And healthcare organisations globally are really struggling into how to best to do so, especially in the presence of the increase in chronic conditions and ageing populations. Basically, to fulfill this fundamental human right, healthcare organisations need to transform into learning healthcare systems, where they're effectively leveraging digital health systems and the data contained within to actually revolutionise care at scale. My vision seeks to really facilitate this transformation. So to transform current healthcare industries into a sustainable learning healthcare system through developing and providing robust governance and support structures to support the transformation efforts that are ongoing, to improve how effectively these systems are being used at the coalface of organisations, to enhance the data contained within these systems so we can actually use this data effectively for secondary use purposes, and to perform ongoing evaluations to foster continuous improvements. To achieve this vision, I seek to draw on my mixed methodology approach of qualitative and quantitative expertise, as well as my interdisciplinary expertise spanning business information systems and health informatics, to really understand the individual, organisational, institutional, and technical factors that are actually underpinning these transformation efforts. And in addition, strong industry collaborations are critical to make sure that the findings that we are generating are actually highly impactful to practice, that they will legitimately make a difference. Each of my research projects actually fit into each of these 4 areas, so they're dedicated at these areas to fulfill this vision. So in terms of governance, we know that healthcare organisations are struggling with the tension of how do we best actually govern these systems to facilitate transformation and innovation whilst adhering and listening to consumer concerns. In addition, AI systems are fundamentally overwhelming existing governance approaches. Solomonides actually notes that as we do not yet understand, nor can fully imagine the extent of the effect AI will have on the practice of medicine and the entire healthcare ecosystem, principles to govern AI systems are really fundamentally essential. As such, we seek to balance these competing values in inter-organisational governance structures, listening to consumers, to healthcare organisations, to government bodies, to researchers and third-party vendors, to really identify and allow for innovation while adhering to the social licence of healthcare consumers. We've started this work. We're in the process of doing systematic literature reviews on federated learning. We're also trying to richly conceptualise how to best balance these tensions as they're occurring. In terms of effective use, our research has already empirically demonstrated that improving how effectively digital health systems are used will improve individual level and organisational benefits. However, improving that effective use is super challenging. And the reason it's challenging is there's so many workarounds in healthcare. But workarounds aren't necessarily bad. Sometimes they're legitimate. Sometimes it's to get around system constraints. Sometimes it's to actually innovate and transform practice of care. So we're seeking to identify how to actually balance this consistency and variation in the effective use of these systems. In terms of data, we know data is core to all of the secondary use processes. Any artificial intelligence that's drawing on this data requires good quality data. Current approaches to data quality are sort of reactive in nature. Let's clean this data. But that's not sustainable either. We need to figure out what the sources of these data quality issues are to target improvements to improving those root causes. Cleaning will still be necessary, but we need some preventative efforts as well. And in terms of evaluations, ICJP, we need to actually evaluate and constantly evaluate how digital health systems are impacting practice so we can figure out where improvements are necessary.